My name is Jill Sclease, and I am a recreation therapist and a driving rehab specialist. So I'm going to talk to you guys today about the organization called AIDED. It's the Association for Driver Rehabilitation Specialists. Sorry, I have an echo. I'm going to leave on my phone. Okay. And I'm going to take my video off because maybe I won't lose you guys. There we go. So AIDED is an association that represents adapted driving providers throughout the United States, Canada, and other countries that I won't go into a whole long list of, but who we are. It is the world's largest provider of driver rehabilitation education and is globally recognized as the standard bearer for driver rehabilitation best practices and professional ethics. We've been around since 1977. And we offer driver rehabilitation to multiple disciplines from allied health provider education providers. I don't want to read this whole slide to you, but basically, we provide a certification to our members so that we are able to serve people in the community with disabilities and assess whether or not they are going to be drivers, or if there's other means of assistance that are required for transportation, things like that. I know that Dr. Lindsay was talking about that transition into adulthood. So whether or not you're going to be a driver or you need to work on transportation or maybe have a vehicle that is transportation, those are the services that we provide. So our purpose is to assess and see if a person, usually the younger people, we determine whether or not they have what we call the potential to drive. So we do an evaluation to see where they are, make recommendations if at this time they're not ready to drive, to help get them back or help get them ready to either sit for their permit or actually drive. We also have what we call an adolescent readiness checklist. For example, we encourage anybody who wants to drive or wants the opportunity to try and drive to go out and do things like go to the grocery store and find 5 items off of a list go to the get your change. Also working on, community mobility, crossing a street or going through a parking lot, being able to scan and look for cars backing up, or the other obstacles that we deal with and are challenged with in a parking lot setting. These are all precursors to driving. Driving is a form of communication, and having those social skills that are involved with manipulating a parking lot or knowing when you can cross the street or not cross the street, and being able to determine the safetiness of those things. We also work with clients who may have a physical disability where they're unable to use the traditional method of a gas and brake and a steering wheel. The picture here in the middle is a gentleman with a spinal cord injury, just as an example, and he uses what we call a wheel and lever because he can't even use mechanical hand controls. He uses more of an electronic system to be able to drive. And just to throw out there, we also do what we call senior safety evaluations, where we assess to determine whether or not a person is safe to continue to drive, or if there needs to be some kind of remediation to work towards them retiring from driving. So through AIDED, we are certified driving rehabilitation specialists, which means we sit for a very, very time-consuming, lengthy examination to determine that we have the skills, but also on diagnoses and how to help work with different cognitive, visual, and physical diagnoses. Our evaluation is very comprehensive. We do a clinical assessment, a behind the wheel assessment, and then we also discuss our outcomes. Our clinical assessment is an interview. We talk to you, we find out what your medical history is, what your social history is, and driving history. If you're not a driver, we're going to ask things like, have you ridden a bike? Have you ridden a tricycle? Have you ever driven like a quad or a dirt bike, or any of those types of things, to see if you have the skills, the motor skills and the planning skills. We do a visual assessment, which is state specific. Every state has their own visual requirements. We do a visual perceptual assessment where we are trying to determine how your brain is processing the information you're seeing. Most people do not realize that driving is 86% visual to 90% visual. So a lot of driving does depend on the visual aspects. We also do a physical function assessment. We want to know how your limbs are working, how your trunk balance is, how your neck rotation is, so that we can determine if you do need any mechanical aids in order to drive. Cognitive assessment with like the rules of the road, traffic sign awareness, and things like that. Our clinical assessment is not a pass or fail. It's us gathering information to determine whether or not you have the skills to drive, to continue driving, or if we need to come up with different activities or processes to assist you to be safe behind the wheel. If you have your learner's permit or your license, we then will take you to the parking lot and do what we call a behind the wheel assessment, where you actually get behind the wheel and we work with you on driving in a parking lot and then progress you as your skill set demonstrates. So there's a couple slides here that just kind of talk about how it works. You know, we do the evaluation. We are all mandated to report to the motor vehicle department. So if somebody does have their driver's license and they're not safe to continue driving, as a CDRS in our states, we are responsible to report that to the motor vehicle department. That doesn't mean if you come in for an evaluation with the potential to drive that we're going to report and say you're not. However, you know, we are responsible to let the motor vehicle department know that you're not safe to drive. Most states are what we call self-reporting. So it is your responsibility if you have your permit or your license. Example, I heard Dr. Lindsay talking about seizures. In the state, I live in Arizona and work in Arizona, 3-month seizure-free policy in order for you to return to drive. So if you were driving, and I'm going to go ahead, I'm getting an unstable. I'm going to stop sharing so that I can stay on. If you are, you know, if for some reason you have a seizure, then you need to stop driving for 3 months. You have to be seizure free for 3 months. That is your responsibility to report. It's your responsibility to go to your doctor and be cleared to return to drive. I am not as familiar with Sturge-Weber as I am with a lot of other diagnoses. So I know that every person that's going to come to us is going to present differently, which is common with most diagnoses. So it's really hard to talk about one thing or another. But if the cognitive abilities are there, the most difficult thing for us to modify for is a cognitive or a visual deficit. A physical deficit is pretty easy for us to come up with some kind of modification with all the equipment that is out there now, with hand controls, electronic driving equipment. You know, I've taught a gentleman with no arms and no legs how to drive, and it just took us coming and looking for things outside of the box to determine how to get them behind the wheel. We do have location, our website, which is aided.net, which I will send Julia all the information so she can share. On that website has a list of our providers in each state. And then that way you can go and discuss with them, one, what your state requirements are, and two, how to get an evaluation. I'm also available if you are struggling with that to contact me, and I'm more than happy to share any and all information or provide direction and get you to whoever needs to be seeing you in order to
Uh-oh. Hopefully she'll come back. We were doing so good too. Oh. Hopefully she'll call in just a moment. Let's see if she does and see what we can do. And then we can get any questions we want answered. While we're waiting, and I'll do some of the thank yous ahead of time because I know we're way past the 3 o'clock time, but I do want to say thank you to our partners at UCB for sponsoring this event today. And also I know Kaylin has a question in the box, so please let us know if she, oh, here comes Jill. All right, let's see. Is she back? There she is, maybe.
I'm so sorry.
No, you're fine. Don't be silly. Technology is great when it works.
It is. So I'm not sure where I froze or anything like that, but I am more than willing to share all of my contact information. And anybody that has a question, please do not hesitate to reach out. If I don't know the answer, I will try and find the answer for you. Driving is a privilege. And if you have the skills and meet the medical necessities in order to do it and want to do it, I think that it's a great opportunity. I know that the seizures do limit a lot of people. Dr. Lindsay also talked about keto, and I have experience with the keto diet and people who've been able to use that diet. And as she said, it's extremely strict, but have limited the amount of seizures that they have. And so, I do have some of those resources. I am not a specialist. I can just get you into contact with people that I know that have done it. But I appreciate you guys reaching out to us for information, because I know that those of us that are CDRSs, we're here because we love what we do and we want to give people the opportunities to have the independence and the freedom and the socialization that driving provides.
Awesome. Thank you, Jill. I know we have some questions for you, if you don't mind.
Okay. Nope, not at all.
Kaylin writes, what are the best ways to relearn how to drive highway when using a car? Oh, this is a good one. And I don't have those problems with the lane keep and or lane assist. They drive me bonkers.
So one of the things that I tell people is try turning it off and get used to your car and then turn it back on. I struggle with it. For example, the vehicle that my sister and I are in California because I was presenting yesterday, and the vehicle that I rented has that lane keep. And I told my sister, I can't do this because it was pushing me off to the right and there were cars over there. So I know a lot of us struggle with some of the technology that's out there. If you can turn it off, if you feel safer with it off, definitely turn it off. But practice on areas that are not busy so that you can see how the car handles, which will make you more comfortable when it is busy, because then you'll know what the car's doing. Like you said, technology is great. I do like some of the things that they're coming up with, but I also struggle with a lot of the technology because it's not for everyone.
So if I could actually clarify, because
Sure.
that's not actually how I meant it. So I'm legally blind in my left, and I've been hesitant to drive highway because I don't have the peripheral vision. So now that I have this new car with the lane assist and the lane keep, like, how do I teach myself, like, it's okay, like, yes, I know I cannot depend on my car to start driving highway again, but like, what are the things that I can do to like take those baby steps so that I can start driving highway? Because like, I intentionally don't drive night because I can't see, like, and I've intentionally not been driving highway because I didn't have a car that I felt comfortable in, that I could do the merge and the changes and all that. So is there anything that you have or like could recommend of like how to teach myself to like be able to go, those 20, 30, 40 miles? Like, I'm not saying like, going straight from nothing to driving from Denver to Casper, Wyoming, like, not like it's not the 2-hour shot, but like, how do I like train myself to start doing that?
So do you use any blind spot mirrors or anything like that on your left side?
So I just got a new car. It's a 2023. So it has the blind spot monitors, it has the lane assist, it has the lane keep, it has the rear view cameras and all of that stuff. So it's a lot easier for me that I don't even, because I don't have those peripheral sides, you know, it'll actually say, hey, there's a car on this side, you know, and if I'm on a 2-lane turn and there's a car on my left, it says, hey, there's a car on your left, you know, so
Right.
that's been really helpful for me.
What I would recommend is go to AutoZone and get one of those small circle mirrors and put on your left mirror where you can actually look in there and see that blind spot. That's going to be the bigger help than just all that. I mean, that helps you say that there's somebody there, but to be able to visually also see it. So I would put that on there, and then I would slowly get on at one exit, go to the next one and get off. And then do that loop a couple of times so that you can get the feel of what it's like on that freeway at the faster speeds, and then start increasing your distance a little bit. But having the actual mirror on the left side, there's also I will try and if I want to give you guys my email address. I'm sorry, what was your name?
I'm Kaylin.
Kaylin, hi.
Yeah.
If you will email me, I want to send you, there's a what we call a rear view add-on that puts on your rear view mirror that actually gives you more visual than even your side mirrors. And I do a lot of my clients who don't have neck rotation so that they can see that blind spot just by looking in their rear view mirror.
Oh, that would be fantastic. Yeah, I will definitely make sure I give you an email.
Yeah, it's going to give you more visual, and then great having those add-ons to help you. So in case you didn't see it, it'll tell you it's there. But without having that peripheral, being able to look up there and see it, that's going to give you that confidence and that stability to say, oh, okay, I saw it. This is great. Thank you, Julia. She gets sent out.
Awesome. Perfect. So, thank you, Jill. I appreciate it. And that's one of the reasons why, like, you know, I wanted to pass your information on to Julia and to everybody else, because I mean, you know, you never know what you can do until you see what you can do. Right. And
absolutely.
You know, I mean, definitely I was scared to start driving, and I didn't start driving till I was 18 because my parents didn't know like what was going on. You know, and again, like I had a lot of things that I couldn't do, but I went to Kessler in New Jersey and they did, you know, the things that you guys do. And it was a really big help to take some of that fear out of it and to just give that independence that we don't have. So I really appreciate everything that you guys do.
Well, thank you. And I love what I do. And it means a lot to me and those of us that do it. And please, if down the road, if, you know, try these mirrors. If that's not working for you, don't hesitate to reach back out. Okay. Because I know how important driving is, and we want you to be safe. Awesome. Julia, do we have other questions? Nice meeting you.
Yeah, Karen has a question. She has her hand up. I'm sorry.
No, it's okay.
Thanks. Okay, so I have a question. My daughter, she's not of driving age yet, but her movements are a little bit, like she has trouble grading her movements. Like she'll, you know, hit something hard when you need to do it more softly and things like that. Also, she probably, we're not sure, but she probably has some peripheral vision loss on both sides. I'm not anxious for her to drive when the time comes, but I don't know. First of all, first question is, with what I described, does that seem like something that would withhold her from driving? And the second thing is, we live in Israel. There's very good bus systems all over the country. In a way, I don't see the need for her to drive, although I know it is a general, like, people want to be able to drive and be independent.
So the vision could probably be her most challenging aspect of driving. I don't know what Israel's laws are, but here, like in Arizona, you have to have what we call 130 degrees of arc between, so it would be like here to here in like one eye. Does that make sense? So you have to have at least good peripheral in one eye. So if she's got peripheral deficits on both sides, that could be the limiting factor for her to drive. Number one. Number two, the grading of, how old is your child?
14.
14, okay. The grading could be a challenge. Is it mainly upper extremities or all extremities that she is?
I would say it could be anything. Yeah.
So, I mean, there are ways without actually seeing your child and doing testing and trials. It's really hard to say. Those could limit as well, but I think there are also options out there. We do work with a lot of clients who have a lot of tone and spasticity, and we're able to compensate for them. It's just everybody's different. But I think the vision is going to be your first hurdle to determine whether or not there's enough peripheral on it. You know, you want it on one side at least, because then you can kind of compensate by turning your head. But if you're missing it on both sides, it could really hinder safety.
Mm-hmm.
So yeah, I think the vision would be something I would look at. There are things called prism glasses that I don't know. I know in Arizona we're allowed to get doctors to recommend them that will help with that peripheral. I don't know exactly how they work because that's not my specialty, but it's they put something on the lens that causes the eye to move and catch that information in where the vision loss is. So that might be something to look into if that's an option. And I don't know, is she doing any PT or OT at this time?
Not right now, but
So they
she
might
should,
be able to,
but she's not.
okay,
Yeah.
well, that might be able to help with some of that grading of her strength, so that she can start regulating it. One of the things that, you know, I've done for clients in the past is get like a box of sand and put like a stick in it and have them practice pushing back and forth to really regulate and strengthen and modify that movement. Mainly to simulate driving, like with hand controls and things like that, or even something where they can, you know, practice the steering and get comfortable with the movement, because sometimes that regulation is hard to do when you're not used to a movement. You kind of try and force it. Just some things that you might want to try.
Okay.
I do know that we have a couple people that are trying to become CDRSs in Israel. I will try and see if I can find that contact information for you.
That would be great. Thank you.
You're welcome.
Cindy writes that her teen son is learning to drive now with off and or left eye vision. Other tips for teaching him, we will be looking for the mirror aids, as you mentioned.
Yeah, I will try and share those, and you can share with everybody. Again, not knowing exactly what the deficit is, I really encourage people, you know, have them focus on turning their heads. Find out where the deficit is by having them in the driver's seat, and then get out, have them looking straight, find out what they are or aren't seeing so that you can do the mirrors to help plan for it. Also, I would consider talking to an ophthalmologist or a neuro-ophthalmologist to see if there's any vision therapy that can be provided to help compensate for that vision loss.
And Caroline writes, are part of your services to teach driving? Knowing that there are extra things to be aware of with some limitations, it would be great to have a knowledgeable teacher.
Yes, we do teach. We do teach. We work with, a lot of my clients that are brand new drivers, we typically do about 60 hours of behind the wheel training. And that starts in a parking lot and depends on how well they progress. We may not even do freeway, get them to a point where they can drive to point A and B safely on a regular basis through different routes. And then 6 months, a year later, have them come back and do freeway. If you aren't hooked up with vocational rehab in your state, I would highly recommend looking into vocational rehab. Again, I can provide some resources for that. But vocational rehab, if you are planning to go to work or your child is planning to work, they have programs to help with adaptive driving evaluation and training. And if modifications are needed, such as some of the vision, they have provided glasses with the prisms or whatever for the client, so that they can do the driving. So they're kind of like a one-stop shop, if you will. I don't mean that badly, but they will help link people to the appropriate resources so that, you know, if driving is part of what they need to do for work, they will help get you there. I will be honest and say that, you know, unfortunately, in all situations, you have to advocate, because some people just don't understand what the process is or what's available. And so they're like, oh, no, we don't offer that. Yeah, they do. They just don't know that they offer it. And so sometimes it's, you know, finding somebody like myself who's aware of it and helping you get to the right person so that you can get the services that that you deserve or your child deserves.
Jill, you're speaking our language here in Sturge-Weber world. You really are. And that's phenomenal. Anybody else have a question? I mean, she's getting it. So go ahead, Priya.
I have a question. So basically I lost my vision in my left eye totally.
Okay.
And I have half vision on my right. So, and and also I have seizures too. So, so to drive us, or does it have to be maintained at 20, like full vision for both the eyes, or is there a solution to to manage whatever vision is there and to just?
So it all depends on where you live. In Arizona, in order for you to be able to drive daytime and nighttime, you have to have 20/40 or better in at least one eye. Okay. So that would be something that you would need to find out where you live. And what I would recommend is go ahead and email me your information and let me see if I can find somebody in your area, or I can at least find what your regulations are.
Okay. Because I asked. I was told a couple of years back, when I wanted to get my permit, saying that I'm not allowed because there would be because I was told there would be risks that like when stopping, when putting a brake, or like they'll suppose if something happens to me, like if I get a seizure or something, then I won't even know. I probably won't even know what happened to me afterwards. So I know as an adult, I know there are certain things that's restricted and we can't do, but since I don't think I'll be able to do it during night, but I may probably able to do it during daytime. But like for whatever vision I have right now, like is there a way to,
Honestly, without testing you and knowing exactly what you have, I really can't answer that. And also knowing where you live, your rules are. You know, if you lived in Arizona and I tested you, it's okay to not have vision in one eye, but I would need to know what exactly your vision is, your acuity, so how well you see detail, and what your peripheral is in that one eye before I can answer that. So that's why, I don't want to say, no, you can't drive, but I can't say, yes, you can drive until I know what you do have or don't have. So
yeah, I get where you're coming from. So, but suppose, like you said, you would answer the questions. I think I missed seeing your contact, your email address.
I know that Julia put it out there. She put it on the chat and she just resent it. So, but if you want to write it down, it's my name, which is Jill.
Is it fine if I screenshot it?
Yeah, absolutely.
Absolutely. Excellent. Does anybody else have any other questions? Okay, gang, we did great today. You made it through almost 4 hours of time. I'm sorry we went over, but we had a lot of great talks today. And thank you, Jill, for being with us today. And of course, thank you. We loved you too. But if you guys need anything or you think of anything after, like I always do, email me personally. And I know you all have my email because I bug you all very much. And I will get you the information needed. And then Jill, I'll look for that information from you as well, so we can get that out to everybody as well.
Sounds good. Thank you. And again, thank you guys for having me. And I look forward to working with you guys in the future.
Me too. Me too. But honestly, guys, have the rest of the weekend. Have a great weekend. And we look forward to talking to you in August when we come back. Okay. Bye, guys.
Thank you. Thank you. Thank you all.
Of course.